Hi guys. So today we are going to cover the rest of chapter 15. So we're going to be talking about blood vessels. So first off, we talked a tiny bit about how blood vessels are the highway of the cardiovascular system. So the blood vessels are going to transport. They're going to transport blood from the heart, take it to the cells of the body so that we can deliver nutrients and oxygen to those cells. It will pick up carbon dioxide and waste products to bring it back to the lungs to be cleared and then back to the heart. It's important to know the types of blood vessels. So arteries carry blood away from the ventricles of the heart. So remember arteries away. They will branch into smaller arterioles, which will then branch into smaller capillaries. Now, capillaries are important because that is the site of gas exchange. So that's how we deliver the substances and nutrients to the body cells and get rid of the waste products and carbon dioxide. Capillaries will converge to form venules, and then venules will converge to form larger veins. So you start out with larger arteries, then you get smaller arterioles, which branch into capillaries, and then you have converging starting to form venules, and then more converging to form the larger veins. So first off, you have branching, then you have converging. This is a picture showing you an artery versus a vein. A couple of things I want to point out really quick. Notice that tunica media, that's the muscular portion of the blood vessel. It's a lot larger in arteries than it is in veins, and that's going to be important later. Also, the lumen of the artery is smaller than the one the veins have. So that's also going to be something we're going to talk about. And then finally, notice that the veins have valves. That's important. Like I said, we'll talk about it all later, but I just wanted to make sure to point it out on the pictures. Angiogenesis is just the formation of new blood vessels. It is mainly controlled by vascular endothelial growth factor, or VEGF. Angiogenesis is going to be regulated in the body because if you have blood vessels just randomly forming, that's not going to be good. Also, tumors, for example, can form their own blood vessels because they can secrete VEGF. And then you're going to have a tumor fed with blood vessels and being nourished. Promoting angiogenesis occurs when your body secretes VEGF, and it's going to be in response to a blocked coronary artery. If that doesn't work, it can be delivered in time-released capsules to try to get angiogenesis to help minimize the damage by that blocked coronary artery. To prevent it, though, like I said, tumors secrete it to nourish themselves. So tumors will secrete VEGF, form new blood vessels, and get bigger. They will keep forming new blood vessels and keep getting larger and larger. So if a tumor has a lot of blood vessel innervation, it's going to be very difficult to remove without losing a ton of blood. So if a tumor is caught early on when it's small, it's going to be a lot easier to remove than once it gets larger. I saw a documentary with a man who had neurofibromatosis, which is a dominant disorder where tumors form all over your body. And he had a relatively large one on his back. And the biggest problem to getting rid of it was the angiogenesis the tumor had done. The tumor had so many blood vessels going to it to nourish it, he was in danger of dying from blood loss to remove it. So anti-angiogenesis drugs are used sometimes to treat cancer and also age-related macular degeneration, which is a problem with the eye. So sometimes this can be successful and stop the tumors from getting larger. Other times, tumors just grow uncontrollably. Okay, so arteries versus veins. Arteries are very thick, have a strong wall, and their wall is thicker than a vein. There's three layers: the tunica interna, the tunica media, and the tunica externa. The tunica interna, as the name implies, is the innermost layer. The tunica media, as the name implies, is the middle layer, and that's made up of smooth muscle and elastic tissue. And then the tunica externa, as the name implies, is the outer layer of connective tissue. The tunica externa is also referred to as the adventitia sometimes, And the tunica interna is sometimes referred to as the intima. So what they do is they transport blood under high blood pressure, and then they're going to branch off into the smaller arterioles. Arterioles are thinner walled. The walls of the middle and outer layers become thinner and thinner as the arterioles become smaller. Both arteries and arterioles can undergo vasoconstriction and vasodilation, so we can control the size and the pressure going through the arteries and arterioles through either vasoconstriction or vasodilation. Small arterioles only have a few muscle fibers in their cell walls, so this is showing you how they get relatively small. The layers are a lot thinner, and then the capillary, which the precapillary sphincter leads to the capillaries. So capillaries are the smallest diameter blood vessels, and they connect the smallest arterioles with the smallest venules. So the arteries will branch into arterioles, which will branch into smaller arterioles to lead to the capillaries. And then coming out of the capillaries, you have the smallest venules, which will converge to form larger venules, which will converge to form veins. So capillaries are extensions of the inner lining of the arterioles. The walls consist of endothelium, so simple squamous endothelium. They're semi-permeable, which is important because they're responsible for gas exchange. Capillary blood flow is regulated by the precapillary sphincters that we saw on the last page and that you can see on this diagram as well. It's basically a smooth muscle surrounding the capillary when it branches off of an arterial or meta-arterial, and that smooth muscle can contract to close off that access or open up so that blood can flow through. So that's really important because when you're talking about blood flow through the capillaries, if we have a lot of blood that needs to be oxygenized, basically, we will open up all of those precapillary sphincters so that all of the blood can get through, but that takes a little time. If we need blood to get through in a hurry, we will close those capillary sphincters so that many of the routes are going to be blocked off to get the blood through the capillaries faster. So capillaries do what's called anastomosis. And anastomosis just means that there's a lot of branches. They branch off. And this is really important because, as you can see from the picture, the blood has a lot of access routes to get through the capillaries. There's not just one way. So if something is blocked, it can go a different route. Substances are exchanged by diffusion. There are openings in the capillaries that are basically the endothelial cells overlapping, so they form little slits. The size of the openings is going to vary depending on the tissue, and permeability will vary depending on the size of the slits. The higher the metabolic rate in the tissue, the denser the capillary networks are going to be. A rich capillary supply in the muscle and nerve tissue is going to be seen because they need a large amount of oxygen and nutrients. So our nervous system and our muscle system works the most in our bodies. So it makes sense that they need a lot of oxygen and nutrients. Tissues like cartilage have fewer capillaries because they have a lower metabolic rate. They don't have as much work to do, so they're not going to need as many nutrients. The job of capillaries is to exchange gases, nutrients, and metabolic byproducts between the blood and the tissue around the cells. 3 ways this can happen. Diffusion, as we just talked about, is the most important method. Lipid-soluble substances will diffuse through the cell membrane. Water-soluble substances diffuse through the membrane channels and slits. So depending on the solubility, that's going to determine what goes through and the way it gets in, basically. That's the most important method, like I said. Filtration is when hydrostatic pressure forces the molecules through the membrane. So the pressure is going to be derived from ventricular contraction. So the ventricles are going to contract, and that's going to cause pressure to be generated, and then that hydrostatic pressure will force the molecules through the membrane. Finally, osmosis. Anytime you hear osmosis, you should think water. So osmosis is when water is drawn into the capillaries, and this actually opposes filtration. So if you have a solute that can't get through, like a plasma protein, that's going to create this osmotic pressure. And then that osmotic pressure is going to draw water into the capillaries. So at the arterial end of the capillary, water and other substances leave the capillary because the hydrostatic pressure is greater than the osmotic pressure. On the other end, at the venular end of the capillary, water is going to enter the capillary because the osmotic pressure is greater than the hydrostatic pressure. So when the hydrostatic pressure is greater than osmotic pressure, water and other substances leave. So that happens on the arterial side. And it makes sense. You want those substances to leave the capillaries at the arteries because we're dropping everything off to the tissues. At the venular end now, the water is going to enter the capillary because the osmotic pressure is greater than the hydrostatic pressure. So we're going to take that back to the heart. Venules are coming off of the capillaries. These are microscopic vessels that transport the blood from the capillaries to the veins. Again, they have thinner walls and less smooth muscle than any arteriole. And then those venules will combine and converge to form veins. Veins have thinner walls than the arteries. They still have those three layers, the tunica interna, tunica media, and tunica externa. But the tunica media is less developed, so it's not as thick, it's not as muscular. Veins carry blood under relatively low pressure and actually function as blood reservoirs. So they're going to hold the greatest volume of blood. Arteries, when the artery comes, the aorta, the main artery, comes out of the heart, that left ventricle pushes it out with such a force that artery has to be able to handle that force, right? Well, veins don't have that force. Veins don't need to have a really thick tunica media because they don't have to push blood like arteries do. So they need the lumen expanded. If you have a large tunica media, your lumen is going to be smaller, like the arteries. But if you have a smaller tunica media, you can have a larger lumen to carry more blood, like the veins do. They also have flap-like valves to prevent backflow. So just like the valves in the heart prevented backflow, these valves do the same thing. So the blood will go up through the valve and then it closes so it can't push back through. About 2/3 of the blood is in the veins and venules at any time. So as you can see, the veins carry most of the blood most of the time. And then this is just a chart showing you the characteristics of blood vessels, the type of walls they have, and their function. So everything we just talked about. Disorders, we've got atherosclerosis, which is cholesterol plaque deposits in the walls of the arteries. Aneurysms, it's a bulge in the wall of the artery, so the artery wall becomes really weak. This happens when the blood pressure dilates a weakened area of the vessel, and that can actually cause a burst. Depending on where the aneurysm is at, it could be treatable or it could be deadly. If you have an aortic aneurysm, you're mostly going to die pretty quickly because the pressure is so high, it comes out and you bleed out before you can get help. But if you have an aneurysm somewhere else in your body, oftentimes they can surgically repair it or give you some sort of modifications and medications to help deal with it. My father-in-law had one, so they went up and repaired it, and he's doing really well. Phlebitis is an inflammation of a vein. This is very common. And varicose veins are those abnormal and irregular dilations in the superficial veins, most common in legs, and it often happens to people who stand a lot. Remember, our veins have most of our blood at all times, and they have to push the blood up all the way from the bottom of our feet to get back to the heart. It's not easy when they do not have a lot of muscle. So oftentimes those valves kind of give way and the blood will pool, and that's what happens when you get varicose veins. Blood pressure is just the force the blood exerts against the inner walls of the blood vessels. Blood pressure is what circulates our blood around. The term blood pressure is most commonly referring to the systemic arteries as opposed to the pulmonary arteries. There's blood pressure throughout our system because we have to maintain that blood pressure in order to keep the blood flowing. Blood is going to move from a higher pressure to a lower pressure throughout the system. So the blood pressure is going to be highest at the aorta coming right out of the heart. Arterial blood pressure rises when the ventricles contract. So that is systole. So contraction is systole, relaxation is diastole. No matter what you're talking about. If you're talking about the ventricles, if you're talking about the atria, it doesn't matter. Contraction is systole, relaxation is diastole. So when the ventricles contract, blood pressure is going to go up. When they relax, blood pressure will fall. Your blood pressure is given in systolic pressure over diastolic pressure. So systolic pressure is that maximum pressure that's reached during ventricular contraction. Diastolic pressure is that minimum pressure that's left over after the ventricle contracts right before it's going to contract again. So it's between contractions, but right before it was ready to contract. Pulse pressure is just the difference between systolic and diastolic pressures. And your mean arterial pressure is the average pressure in the arterial system. So this is the driving force to get blood to the tissues. So it's calculated by your diastolic pressure plus 1/3 the pulse pressure. Blood pressure stated as a fraction is 120/80. That's the normal blood pressure now. Anything higher than that, you have high blood pressure. Lower than that, you have low blood pressure. And it's stated in units of millimeters of mercury. Arterial blood pressure is going to be measured with a sphygmomanometer. Blood pressure decreases as the distance from the left ventricle increases. So as I said, it's going to be highest at the aorta coming right off the heart. It's going to be lowest at the vena cava coming back to the heart. So the further away it gets from that ventricle, the lower the pressure is going to be. These are the sites where you can most easily detect the pulse. So the brachial artery and the radial artery are two pretty important ones. The brachial artery is what you're measuring actually with the sphygmomanometer. And the radial artery is what you can feel on the thumb side of your wrist. And make sure that you know that. The lateral side of the wrist, so the thumb side, on the anterior side is the radial artery blood pressure. Brachial artery, as I said, is what we're doing when we read our blood pressure. You also have the inguinal region for the femoral artery, the popliteal region for the popliteal artery, the anterior ankle for the dorsalis pedis artery, and the posterior ankle for the posterior tibia artery. Now, oftentimes, if there's damage to legs, doctors will check the anterior and posterior ankle to see if those pressures can be felt. Because if they can, that means it's still getting blood flow to the feet. If we can't feel them, that means blood flow is blocked somewhere. Some factors increase arterial blood pressure. Your blood volume increases, your heart rate increases, your stroke volume increases, your blood pressure is going to increase. Blood viscosity increases, that's the thickness of our blood. Or peripheral resistance increases. These are all going to increase our blood pressure. Cardiac output is the volume of blood discharged from a ventricle each minute. It's equal to stroke volume times the heart rate. So stroke volume is the volume of blood that enters the arteries with each ventricular contraction. It's usually about 70 milliliters per beat. So cardiac output normally, if you take stroke volume, which is about 70 milliliters per beat, times your heart rate, which average is about 72 beats per minute, so you're talking about 5,040 milliliters per minute is pumped. Blood pressure is going to vary with cardiac output. If you increase your stroke volume or heart rate, you're going to increase your cardiac output. That's going to then increase the blood pressure. Blood volume is just the sum of the volumes of the plasma and the formed elements. This is going to vary, of course, by body size, but also by gender and age. It's about 5 liters for adults, 4 to 5 for females, 5 to 6 for males. It's about 8% of our body weight. Blood pressure is directly proportional to blood volume. So any factor that changes blood volume can change your blood pressure. So a decreased blood volume, like if you have a hemorrhage or a lot of blood loss, will actually decrease blood pressure. Peripheral resistance, just think about what the name is. Resistance means it's going against it. So it's the force of the friction between the blood and the walls of the blood vessels. Blood pressure has to overcome that peripheral resistance in order to flow, because the blood has to flow through those blood vessels, so that friction has to somehow be overcome. Anything that can change peripheral resistance will also change blood pressure. For example, vasoconstriction of the arterioles is going to increase the peripheral resistance, which is going to increase blood pressure. Think about it. Vasoconstriction, you're making it smaller. Making it smaller is going to increase that resistance, which in turn will increase your blood pressure. When the blood is pumped out of the ventricles, the arteries swell. There's a rapid elastic recoil that's going to send the blood through the arteries, going against the peripheral resistance in the arterioles and capillaries. So that's one reason why that left ventricle has to be so strong. It's got to pump that blood out to the aorta, which will then take it to the body cells with a lot of force, so that we can overcome the peripheral resistance and get the blood where it needs to go. Viscosity refers to the thickness of the blood. So this is the difficulty with molecules of fluid that flow past each other. The greater the viscosity, the greater the resistance to blood flow. So just think about it. The thicker your blood, the harder it's going to be for the blood to flow through the blood vessels. Blood cells and plasma proteins increase the viscosity of the blood. If you have a greater resistance to the flow, that's going to mean a greater force is necessary to transport the blood. So your blood pressure is going to increase. Anything that alters the concentration of blood cells or plasma proteins will alter the viscosity. For example, anemia lowers the concentration of blood cells, which will lower the blood viscosity, which will lower the blood pressure. On the other hand, if you have an excess of red blood cells, that's going to increase the blood viscosity and increase the blood pressure. Blood pressure is determined by cardiac output and peripheral resistance. So maintenance of blood pressure, you have to regulate those two factors. And there's a picture of the negative feedback loop that shows you how this is accomplished. So if your cardiac output increases, your blood pressure is going to increase. The baroreceptors in the aortic arch and the carotid sinuses are going to be stimulated. That's going to send sensory impulses to the cardiac center. The parasympathetic impulses are going to then travel to the heart to inhibit the SA node. Your heart rate will decrease and your blood pressure will start to go back to normal. On the other side, you got the rising blood pressure that stimulates those receptors, sends the sensory impulses to the vasomotor center, which will then be inhibited. So you won't have as many impulses from the sympathetic system going to the arterial walls. The arterioles will vasodilate, so they're going to open up. They open up and decrease that peripheral resistance, so your blood pressure can then turn back to normal. Hypertension is high blood pressure. High blood pressure can happen for a few moments, it can happen for a few days, or it can be long-lasting. The long-lasting elevated pressure is what we need to worry about. Sometimes we don't know why it happens. You have an increased sodium intake, psychological stress that activates the sympathetic nervous system can have it. Obesity can do it by increasing that peripheral resistance. And kidney disease can do it because of the renin-angiotensin response. Now remember, we talked about the renin-angiotensin response when we talked about hormones. So that's why it can actually cause high blood pressure. It's known as a silent killer because it doesn't have a lot of any direct symptoms. It also contributes to the formation of atherosclerosis, which can lead to blockage in the heart and heart failure. It can lead to coronary thrombosis or embolisms. So you could get blood clots all over the place in your heart. Also cerebral thrombosis and embolism. So you could get blood clots in your brain. This might lead to a transient ischemic attack, which is basically a mini stroke, or an actual stroke. How do we prevent it? Well, we can eat a healthy diet, we can lose weight, we can exercise regularly and limit our sodium intake. Treatments are usually diuretics and sympathetic inhibitors. Blood pressure decreases as it moves through the arterial system into the capillary network. So by the time it gets to the venous system, it's not very high. Venous blood flow is actually only due in part to the heart. It also has to depend on 3 other things. First off, the skeletal muscle contraction. A lot of our veins, if you look at the picture here, there are skeletal muscles on each side of them. They will contract to squeeze the blood up through like they're squeezing a tube of toothpaste. Those valves are going to help by preventing backflow. So blood will get through the valve and then keep going because it can't go back. Our breathing movements. When we inhale, we pull blood up towards our heart. So it relies on that. And then vasoconstriction of the veins. So when we can constrict them so that it can squeeze more blood up. All of the veins except the ones returning to the heart from the lungs drain into the right atrium. The pressure in the right atrium is called the central venous pressure. Factors that influence it are also going to alter the flow of blood into the right atrium, and it's going to affect the pressure within those peripheral veins. If your heart is beating weakly, it's going to increase the central venous pressure. An increase in the central venous pressure will cause the blood to back up to the peripheral veins. That can lead to peripheral edema. An increase in blood volume or venoconstriction increases the blood flow to the right atrium, which will increase central venous pressure. So it's really important for you guys to understand that everything is connected. If something changes with our stroke volume, cardiac output's going to change. If something changes with the peripheral resistance, our blood pressure is going to change. So everything is connected to where if something happens in one thing, all of these other things are affected. So it's really important for you guys to understand that everything's connected in our bodies. So you need to be making these connections as we're going through these chapters. We were talking about the renin-angiotensin mechanism that we talked about from the endocrine system. So make these connections as we're going through these chapters. Exercise, of course, is good for the heart, but it has to be regular. You can't just exercise one day and be like, yes, I did it, I'm done. You have to keep doing it regularly. That doesn't mean you have to exercise every day, but do something. Go for a walk. Everybody can walk. Even if I have 7 ruptured discs in my back. I have a morphine pump to help regulate the pain. But I walk because, one, I enjoy it. It helps me release some stress, which I've told you guys a million times. You have got to release that stress. So walking helps me do it, but it also helps me stay slightly healthier and get a little bit of exercise. So even if you start doing small things, like when you go to Walmart, park all the way at the back so you have to walk. Something simple like that can get you started. You don't have to start with a full-blown aerobics class. So exercise is going to increase that pumping efficiency, the blood volume, the hemoglobin concentration, and the number of mitochondria, which of course generate ATP. The heart may enlarge 40% or more, and stroke volume, heart rate, and blood pressure are going to decrease. Stroke volume is going to increase. So for exercise to benefit the cardiovascular system, you have to increase your heart rate to about 70 to 85% of the maximum. Has to last at least 30 to 60 minutes and be 3 to 4 times a week. So, like I said, start out small so that you can get there. When you exercise, well, not when you're exercising, but after you exercise, your heart rate, your blood pressure is going to decrease overall. Your stroke volume is going to increase, which is going to make cardiac output more efficient. So keeping your heart rate elevated while you're exercising, even if it's just walking, for 30 to 60 minutes, 3 to 4 times a week, it's actually going to make yourself more efficient and healthier. Blood vessels form two pathways, the pulmonary circuit and the systemic circuit. Pulmonary, anytime you hear that, you should think of lungs. Systemic is the rest of the body. So the pulmonary circuit, you go from the right ventricle to the pulmonary trunk, through the right and left pulmonary arteries, to the lobar branches, to the pulmonary arterioles, through the pulmonary capillaries, to the pulmonary venules and veins, to the left atrium. Blood in the pulmonary arteries and arterioles is going to be low in oxygen, high in carbon dioxide, because what we're doing is we're bringing the blood back from the body. So we have very little oxygen. It's full of carbon dioxide that we got to get rid of. Capillaries in the lungs are going to exchange the oxygen and carbon dioxide. So they're going to take the carbon dioxide to get rid of and put oxygen back into the blood. Blood in the pulmonary venules and veins is going to be rich in oxygen and low in carbon dioxide because it's going to be delivered back to the body. The systemic circuit, you have oxygen-rich blood moving from that left atrium to the left ventricle, and then the contraction of the left ventricle is going to send the blood out into systemic circulation. So the left ventricle is going to send blood to the aorta, which will then take it to all of the arteries and arterioles in the body tissues, to the systemic capillaries, to the systemic venules and veins, back to the right atrium. The aorta is the largest artery in the body. It supplies blood to all of the systemic arteries. And this is showing you major branches of the aorta. Notice there's a couple in red there. Make sure you know those. This is showing you major vessels associated with the heart. We talked about a little bit about how the heart doesn't use the blood that it pumps. It actually has its own circulation. Well, this is showing you those major arteries that are coming out of the heart that are going to pump the blood either to the lungs or to the rest of the body. These are the major branches of the abdominal aorta. So the aorta basically changes its name based on the area of the body that it's at. Branches of the subclavian and common carotid arteries actually supply blood to the brain, head, and neck. The circle of Willis is important clinically speaking. It joins the carotid and vertebral artery systems that supply the blood to the brain. So there are ways that the blood can still get to the brain if there's a blockage. There are alternate pathways, but oftentimes strokes will occur in this area. The subclavian artery gives off branches in the neck and continues to the arm. Blood reaches the thoracic wall through the branches of several vessels, including the subclavian artery and the thoracic aorta. The abdominal aorta divides into the common iliac arteries, which then supply blood to the pelvic organs, the gluteal region, and the lower limbs. The common iliac artery divides into the internal iliac artery and external iliac artery. The internal iliac supplies blood to the pelvis and gluteal areas. Very importantly, the popliteal artery is right behind the knee. This is showing you the venous system. So the systemic venous circulation is going to return to the blood to the heart after all of the gases, nutrients, and waste have been exchanged. Vessels of the venous system originate from the merging of the capillaries into venules, venules into small veins, and small veins into larger ones. Unlike the arterial pathway, the venous system isn't very easy to follow. There are some irregular networks. We have some unnamed tributaries there. Pathways of the larger veins, however, are usually parallel to the arteries of the same name. All systemic veins are going to converge into the superior and inferior vena cava, and then return to the heart through the right atrium. Then it will go through the tricuspid valve, through the right ventricle, through the pulmonary valve to get to the lungs. And then the lungs is where the gas exchange is going to occur. The external jugular vein drains blood from the face, scalp, and superficial neck. Internal jugular veins drain blood from the brain and deeper portions of the face and neck. There's two systems of veins that drain the upper limbs and shoulders. You can read those on your own. Again, you can read this just fine. Portal veins are unusual because they do not transport blood directly to the heart. The hepatic portal system is the probably most talked about. That involves the liver. So the blood from the capillaries in the stomach, intestines, pancreas, and spleen are going to drain into the hepatic portal vein, which is then going to transport it to the liver for processing before taking it back to the vena cava. This is just showing you the portal systems. The great saphenous vein is the longest vein in the body. That's very important. So what happens as we get older? We have talked about this in every chapter. As we get older, things start to go downhill. Our circulatory system is no different. Cholesterol deposition is going to start to happen in the blood vessels, and you're going to develop atherosclerosis and plaques if that happens. Your coronary arteries will get more narrow, so it's going to be harder for the blood to get through. Your heart may actually shrink a little bit or enlarge due to disease. The proportion of the heart consisting of the cardiac muscle actually starts to go down. You have an increase in the fibrous connective tissue of the heart and the adipose tissue of the heart. So your heart generally starts to get a little bit weaker over time. The heart valves in the left ventricular wall may thicken. Your systolic blood pressure can go up. Your resting heart rate goes down though. The arterial elasticity decreases, and that's a bad thing because you want your arteries to be elastic enough to handle that blood coming out from the heart. The lumens of the large arteries narrow because those arterial walls start to thicken. Both environmental and hereditary factors contribute to cardiovascular disease. Marfan syndrome, you have a connective tissue defect because of the protein fibrillin. You have an abnormal type. The biggest thing is it can weaken the wall of the aorta, so people with Marfan syndrome are often told not to do a lot of activity. Familiar hypertrophic cardiomyopathy, you have a myosin defect. There's an abnormal chain in the cardiac muscle, and again, can result in sudden death. Inherited deficiency of a mitochondrial enzyme that breaks down fatty acids can cause heart failure. And familial hypocholesteremia, you have an abnormal LDL receptors on the liver cells, so they do not take up cholesterol from the blood very well, which will result in high cholesterol, plaques being developed, and coronary artery disease, which is a disease involving the deposition of the cholesterol plaque on the inner walls. It leads to the obstruction of coronary arteries, so you're going to have an oxygen deficiency in the cardiac muscle. Your heart isn't going to be nourished as well as it should be. Oftentimes, you'll have high serum cholesterol and high blood pressure. Oftentimes, you have pain in your chest when you do anything. That's called angina pectoris. This is a major contributor to a heart attack. Treatments, you could have coronary bypass surgery or percutaneous transluminal coronary angioplasty. So they basically will try to fix the blockages. So that is all. I will see you guys for the next chapter.